So if we look at the topic of the presentation, my presentation today is a bit off tangent because the theme, as you can see, is about cognitive decline in elderly and the effect of various factors in determining cognitive decline. So let me speak a bit on why I choose this topic. The reason being, our preliminary analysis so far shows actually that sensory impairment, in particular hearing impairment as well as dual sensory impairment, are significantly associated with cognitive impairment. And I'm talking about the odd ratio of hearing impairment in contributing to cognitive impairment is about 4.6, whereas for dual sensory impairment, the odd ratio for giving rise to cognitive impairment is in the region of 6-fold. And also from my observation in audiologists, I see that even though the prevalence of hearing impairment is really high in our population, but when it comes to the hearing aid adoption or looking at the treatment-seeking behavior, it is still very poor. So that's why in this presentation today, I am giving you the snapshot of what we found as far as hearing loss in our population is concerned. So visual and hearing impairment are highly prevalent in older adults, but receive less attention compared to other health conditions, and this is especially so in our country. I can cite a few reasons for this. The first one could be that optometry and audiology are fairly young professions in this country, and many of the professionals working in these two professions are still looking at or focusing at treating or managing visual impairment, and there are not many optometrists or audiologists who are interested at looking at how vision and hearing impairment affect other functions such as cognitive function. And age-related vision and hearing impairment are two of the most prevalent chronic conditions affecting quality of life and medical service use among older Americans. That is what has been reported in the US. And again, maybe the other reason why visual and hearing impairment are not receiving enough attention could be because of both non-life threatening and looking at the adoption of eyeglasses and contact lenses, and if we compare that to hearing aid, again, adoption of hearing aid is far much less, and that is applicable not only in our country but also if we compare that in other developed countries like the US, for example. So these are the percentage of affected people using correct devices. Okay, what is shown here is the percentage of people, for example, the first bar here, who have hearing or vision impairment, and you can see that 75% of them are wearing corrective devices, and compared to people who suffer diabetes, for example, 75% of them are on some kind of treatment, and so on and so forth. And we look at the percentage of people with hearing impairment who adopt hearing aids are very low there, 25%. That is what has been reported in the US. And reasons for low hearing aid adoption could be subjective perception. Most adults with hearing loss are either not aware or in denial of having hearing problem. Actually, and that data I will show you in a moment. And also stigma attached to hearing loss or hearing aids. I can even ask the audience, for example, if you are to have hearing impairment, how many of you are willing to admit of having hearing impairment, and how many of you are actually keen to go and seek for help in the sense of getting hearing aids in your life? That partly is because the stigma attached to hearing loss and hearing aids usage. And hearing aids do not impact normal hearing. That could be one of the reasons also why many people with hearing impairment are not so keen about wearing hearing aids. It is hearing impairment is unlike having visual impairment. If we have visual acuity problems, for example, due to refractive error, we just go to optometrists. Optometrists will prescribe you with glasses, and once glasses are ready, we just put it on, give us a period of 2 weeks or so, we will get used to the spectacles, but not with hearing impairment, especially when the hearing impairment is due to sensory loss resulting from the inner ear damage. So in those type of cases, very often use of hearing aid will not be able to give back our normal hearing. That can be one of the reasons for not low acceptance of hearing aids. And of course, there are issues with cost. If you compare the cost for spectacles and hearing aids can easily be 4 times more expensive than the normal spectacles. I'm talking about not the high-end spectacles. And the studies also show that 1 in 5 individuals who claim to have hearing loss was not ready to wear hearing aids. Yeah? And 84% of participants believe that hearing loss only occurs among elderly. Now, the aim of this presentation is to examine the prevalence of the objectively measured single and dual sensory impairment in elderly. I stress the word objectively measured because if you look at many studies, especially on population study, the hearing and vision are measured using perception to questionnaire by asking, do you think you have vision loss? Do you think you have hearing problem? That is one of the example. And how do we compare with other countries? Okay, in other countries, for example, okay, we have to look at the blue chart here. Previously, in our data shows that only about 3% of our population with hearing impairment actually adopt hearing aid. But compared to other countries, of course, in our country, the adoption rates of hearing aids are very, very low. Do we need to worry about this? Yes, the answer I think is yes, because cognitive decline is significantly associated with hearing impairment. There are many studies that shows that the decline in cognitive function in older adults with hearing impairment is much more compared to those without hearing loss. And in older adults, hearing impairment would have a 24% increase risk of or decline in cognitive function over time, and may experience a 30 to 40% faster decline than those without hearing loss. Even if we are to only focus to those with mild to moderate hearing impairment, that condition is associated with poorer executive function and psychomotor processing, lower score, and memory test. And this is what we are planning to assess in our samples that we have also. So in conclusion, hearing loss is perceived as less important than visual impairment, and self-perceived hearing loss is low among those who are objectively confirmed with hearing impairment. And again, as I mentioned earlier, the implication of assessing hearing impairment based on survey form needs to be considered. Hearing aid adoption is very low, but increased visibility of hearing loss and higher among those with perceived hearing loss. So ways to improve hearing aid adoptions: number one, individuals should recognize that they have hearing impairment. Okay? And we should promote awareness about hearing impairment and potential benefits of hearing aids to public and health professionals. This is especially so when our initial or preliminary analysis also confirmed that there is an association between hearing impairment and cognitive impairment. Education of both public and professional audiences is also needed to specifically address the effect of sensory loss and emphasize the sensory loss should neither be ignored nor considered to be normal part of aging. So I would like to conclude by maybe conveying message to our elderly populations who are also here. Yang saya nak memberi sedikit petua ya. Jadi yang pertama dapatan daripada kajian ini adalah menunjukkan bahawa kebanyakan daripada warga tua yang mempunyai masalah pendengaran tidak merasakan mereka mempunyai masalah pendengaran. Itu yang pertama. Okay? Dan yang kedua, ramai yang mempunyai masalah pendengaran tidak pergi mendapatkan rawatan untuk pendengaran, dan itu adalah satu perkara yang perlu diambil perhatian, terutama sekali apabila nampak sebenarnya ada hubung kait antara masalah pendengaran dengan masalah kognitif. Jadi itu saja yang saya ingin perkatakan untuk